Well, thank you very much. Thank you very much for the invitation to speak. And if you can see my slides, if you can see my title slide, then I don't think I've exactly responded to your invitation to be less bleak. The slide that should be showing is an illustration of what happens when you have a global pandemic in the middle of an ongoing climate crisis. Basically, the effects of, effectively multiply. The slide here is taken from the US, where wildfires were sweeping through the western United States, partly probably driven by high temperatures and drying in that part of the world, at the same time as we were giving people instructions on how they should behave in order to protect themselves from the COVID-19 pandemic. So I won't completely avoid the bleakness of the situation, but certainly to take the invitation to say what we think we can do about this at a national or at a global policy level. And first off, thanks very much to the other presenters for providing the information on the risks that are the health risks that are particularly faced in East Africa from climate change, but also some of the sort of the detailed information on how that affects communities and what can be done at the community level. So I was invited to speak a little bit about what we have learned from COVID-19, and I think some of the parallels, some of the instructions for how we protect health in the face of climate change. One of the, I think there are a few lessons. Some of them I think have been quite well summed up by the climate protesters, the young climate protesters who are mobilizing around the world to try and pressure leaders to take action on climate change. One of them is to treat a crisis like a crisis. We have known the evidence on the effects of what is driving climate change, the effects of climate change on health in general terms for a very long time now. It's very nice to see Andrew on the call. You know, I've known Andrew for a long time, and one of the people who's been researching for the longest on the impacts of climate change on health. And one of the things that we have learned from COVID-19 that we should have already been doing on climate change was basically to follow the evidence that we know that we knew very quickly, in fact, within the first couple of weeks of what was happening with COVID-19. We knew what the pathogen was, we knew how it was transmitted, we knew in general terms what it would take to protect ourselves. And to a great extent, countries around the world have followed the evidence and have put into place protective measures. And those that have done the best are the ones that have stuck most closely to the evidence, and that also have had clear leadership, strong public health communication. So those are exactly the kinds of lessons that we should have already been applying to climate change. And it's never too late. We still have that opportunity to respond in the way that we should respond. Another of the lessons that we have taken from COVID-19 is the importance of protecting the most vulnerable. Again, it's very clear with COVID which parts of the population are most vulnerable, which age groups in particular are most vulnerable, and you can see that in the delivery of vaccines in those countries that do have vaccines, that they're very much targeted on particular parts of the population because that vulnerability was recognized and characterized quite early. And another message, again, from COVID-19 is the importance of global solidarity. Again, we're seeing that, I would say, not in a particularly good way at the moment with the distribution of vaccines, where we have an extremely inequitable situation in terms of who is getting the vaccines. It's basically those countries that can afford them and that were able to buy up supply, perhaps even over contracting vaccines. Whereas those populations, including those in low and middle income countries, including much of your region, still have no or very limited supply of vaccines. That's not good for anybody. And global solidarity and international cooperation is as relevant to vaccine distribution or the response to the COVID pandemic as it is to the climate crisis. And I think one of the other general lessons that we're taking from this is that you have to update your understanding as you go along, and the faster you do it, the better. One of the examples from COVID-19 is that the countries, the populations that we thought would be most vulnerable, would be most ill prepared to deal with a pandemic of the kind of COVID-19, that is not necessarily how it panned out. Famously, not long before the pandemic hit, there was an index published of countries' preparedness for a pandemic, which ranked the European countries, ranked the US as the best prepared to deal with the pandemic. And that is very much not how it has panned out. That just underlines that it's not all about money. It's also about the strength of your public health system. It's also about the clarity of leadership and the extent to which communities can be mobilized in order to take the measures that should be taken. And again, that is something a lesson that we think we can apply to the climate crisis. So moving from those sort of general lessons about the parallels between COVID-19 and climate change, one of the things that we have been doing at WHO in response to COVID-19 from quite early on in the pandemic, so from May of last year, we published a manifesto on a healthy and green recovery from COVID-19, because although most of our attention and the attention of national governments from around the world was focused on putting into place public health measures, on locking down economies and so on to stop transmission, we also saw that the decisions that were going to be taken in order to prop up economies or to recover from the COVID-19 pandemic, if we got them wrong, would be really bad for public health and for the environment over the longer term. So we published what we called a manifesto for a healthy recovery from COVID-19, but an emphasis also on environmental protection as well, with 6 prescriptions that you can see on the right. So the importance of protecting nature, that's including to reduce the risk of future pandemics, because there is some evidence that, there is evidence that all of the pandemics that we've suffered from in past decades have come from the natural environment, and some indication that that's due to environmental degradation, accelerating their emergence from the natural environment. The importance of ensuring basic services, so water and sanitation, energy supply, and so on. So the kinds of things that we're just hearing on the presentation on urban sanitation. One of the lessons that we see is that we have a real problem with climate vulnerability in populations that don't have things like basic water and sanitation or decent provision of public health services and functioning healthcare facilities and so on. So we want to make sure that as investments come in to drive the recovery from COVID-19, that they invest in things like that. The importance of healthy and sustainable food systems. We heard earlier a little about the effects of climate change on food security, particularly in East Africa. You'll also be aware, and it is also an issue in your part of the world, that the world suffers about as much ill health now from overweight and obesity and unhealthy food systems, food and nutrition systems and practices as it does from undernutrition. And that's also a major driver of carbon emissions and therefore the climate crisis. So there is an importance in supporting sustainable and healthy food systems. You'll also be aware that most of the global population now lives in cities, again, a trend that's important in your region. So it's important to invest in cities that are sustainable, they're livable, that enable walking and cycling, that reduce air pollution, that are safe and secure, and so on. And the final one is that we prescribed is to stop subsidizing pollution. At the moment, the world spends a lot of direct cash in subsidizing the fossil fuel industry, which is also the main driver of air pollution, which kills about 7 million people a year around the world. And we effectively subsidize them even more because the health impacts of those unsustainable and unhealthy energy systems are massive. As I mentioned, those 7 million deaths a year from air pollution around the world are effectively a subsidy that we allow the fossil fuel industry or polluting energy to have, because they're not paying the costs to ill health of populations. So those are the high-level messages that we were sending about the direction of travel that we thought needed to happen. in the recovery from COVID-19. And then to get on a little bit more specifically to the overall tasks that we see for public health in the face of climate change. So we tend to sum these up from WHO in three tasks. One is in getting behind the drive to reduction in global emissions. We all know that the world is well off track for meeting its commitments to the Paris Agreement. We're more on a trend which is just carrying on increasing emissions. And we think that health not only has to play its part, but actually has some really good arguments for why countries should shift to cleaner energy sources. The reduction in air pollution is just one of them. So we think that health has a critical role to play in decarbonisation. The next, the one that I'll talk about most in the next few minutes, and the one that you've heard most about already, is in protecting health from the full range of climate risks. And you've already had a really good introduction to those: extreme weather events, improved conditions for infectious disease transmission by vectors or by water, and also things like the gradual rise in sea levels, which will make parts of the world uninhabitable and therefore a massive public health catastrophe. And then finally, we have an increased focus on what should actually go in within healthcare facilities as the place where most health services are delivered, and a particular drive to make them resilient to climate risks, to weather extremes and so on, but also to make them sustainable as well. So in many cases, the interventions or the choices we would make about how we would supply water or how we would supply energy, sometimes now it's the environmentally sustainable choice, which is also the cheapest and the best for public health as well. So we have an interest in driving that change. So just briefly, just one slide on the kinds of ways in which health can contribute to that drive to reduced emissions. It's been estimated by the International Monetary Fund, the IMF, that many countries are now putting a price on carbon, putting in place carbon taxes. It's been estimated that if that price on carbon was also set at a level that took into account the public health damages, particularly via air pollution, then you would have a large financial incentive to shift to greener energy in a way that you would have significant cuts in greenhouse gas emissions and also in air pollution, and you would generate revenues that could be invested in health services and so on. And a very large part of the justification, the economic, the valuation, the justification for a price on carbon is actually the avoided damages to health, it's the health benefits. So we think that's an example of where health can contribute to the arguments for reduced carbon emissions. But the part that I'll talk about just a little bit more in the next few minutes is on the overall approach to improving population resilience to climate risks, whether it's through health facilities, health systems, or in the community as a whole. And the approach that we have adopted to this over the past few years is that we've done a certain amount of work of the kinds of projects that you were hearing in the last presentation, working with particular countries on particular health impacts or routes through extreme weather events, heat waves, or effects on water and sanitation, vector-borne disease, and so on. And we wanted to sort of generalize that to say, okay, what is the overall approach that countries should adopt if they want to strengthen their resilience to health risks, health system resilience to climate risks as a whole. So we've adopted a systems-based approach. We published an operational framework for building climate resilient health systems in 2015. And that says in the context of a health system, and health system including the outreach to communities, they're continually challenged by shocks like extreme weather events, floods, droughts, and so on, but also long-term stresses. And we have the opportunity to, what we're trying to do is to reduce vulnerability by reducing exposure, protecting people, keeping them out of harm's way, reducing the sensitivity, so that the degree to which when a weather event hits, that actually feeds through into the community. A good example of this is that we know that in populations that have good sanitation systems, the impact of higher temperatures or a flooding event is much lower than in those populations which don't have good sanitation systems. So that's the way in which we can reduce sensitivity, is by providing those essential services. but also by increasing adaptive capacity. So actually taking account of health risks and putting into place specific measures to deal with the risks that come from climate change. And what that does is to put us on it more towards the high end of what you see on the right in terms of the outcome options. So ideally, transforming systems so they're actually better than they were before we started considering climate change risks, and avoiding what happens at the bottom, which is where accumulation of climate risks cause a system to collapse. So that's the general systems-based approach that we have taken to this. And we also took the choice to say, well, we don't want to come in and try and reinvent health systems for climate change. Health systems are already in place. They're doing a fantastic job, usually the best job they possibly can, given the resources they have available. Is to say we start with what is already there, and most health systems people will recognize building blocks of health systems around leadership, around finance, around information systems, delivery of basic services. So that's the core, what's at the center of the diagram you should be seeing. And then what we did was to say, okay, there are additional functions that you need to build onto those to deal with climate risks. So if you already have governance of health systems, well, you also need to think now about reaching out to the other sectors like water and sanitation, food systems, and so on, to take account of climate risks. You already have the investments you make in health workforce. Well, now you also probably need to train people on climate risks as well, and so on around the system. And just to illustrate a few of the ones at which we're concentrating on from WHO, is to point out that additional finance does need to come into health systems to deal with climate risks. At the moment, this is almost entirely neglected from climate finance. There is effectively just about no investment. There's less than 1% of multilateral climate finance from the Green Climate Fund or others actually goes into protecting people's health. So that should change. We also have a particular demand from countries. A lot of ministries of health understand the systems-based approach, but they say, okay, but we're responsible for hospitals, we're responsible for doctors and nurses. So they're particularly interested in knowing what they can do with their infrastructure or with their healthcare facilities. We also know that we need to invest, we have a demand for investing in health workforces, the most important part of any health system. And also, and this is maybe a link to ICPAC, one of the consistent demands that we've always had is for climate-informed surveillance systems. So the kind of work that Andrew does and that we're working with Ethiopia and others to support. So it is really important that we have access to meteorological information in order to build risk mapping and surveillance systems that can support public health programs. We're really happy to work with meteorological agencies on that, but it's also to understand that that's just part of the picture that we're trying to promote in the systems-based approach. Just in the last couple of minutes, I just wanted to point out where we think we are in terms of progress on this issue. We generally see that over the years we've been working on this issue, that the amount of interest, the amount of engagement on this has increased significantly. I mean, when people like Andrew and myself a few years later started working on this issue, there were only really 5 or 10 people around the world who were really engaging on climate change and health. That's changed, and now ministries of health do recognize that it's important, and that there is the same recognition from the climate change side as well. So we see, for example, that in the nationally determined contributions to the Paris Agreement, most countries do mention health. They do say it's important. A large proportion of countries now develop a health adaptation plan and include that within their overall climate change response. The problems that we see are that, for example, countries are not valuing the health gains that would come from low carbon development trajectories. They could quantify them, they could value them. For the most part, they're not. And we also see this deficit in support that actually comes to protecting health from climate change. So it's progress, but there are still big gaps. We also see increased recognition within the climate change discussions as well. So this slide is a slide that's actually from the UK presidency of the Climate Change Convention this year. They will be hosting the COP meeting this year. Along the top are their 5 campaign aims, and along the bottom are the connections that they are already making between health and their campaign aims. And we're working with them on this. And so I won't dwell on this slide, but just to say that there is now a much greater appreciation of the links between health and climate change. And that's partly because many of us have been working on this for a long time, but it's largely this year because of the impact of COVID that everybody is now relating COVID and health to everything they do, including health, including climate change, sorry. And so the final slides are just to point out that the UK presidency has now identified health as one of its flagship priorities, alongside, it's one of 3 priorities alongside water and infrastructure. So we see it as being sort of at the big table now on the climate change discussions. And they're also planning to launch a series of initiatives to reinforce that priority on building climate resilient health systems, on reducing emissions from health systems around the world, and in mobilizing the health community as a trusted voice that could advocate for climate action. And just, I think this is the final slide, just to underline the importance of that voice. The trust, the importance of the health community as trusted advocates and trusted partners is second to none. This is a slide, this is public polling from the UK to basically ask people in the street who they trust more from different professions. Doctors and nurses are the single most trusted profession, which just underlines, I think, the importance of linking between climate change and health, and the important role the health community can play in driving action both on mitigation and on adaptation. So I'll stop there and thank you once again for the invitation, and happy to discuss further. Thank you.